Now, the size zero debate has recently focused attention on the dangers of anorexia and bulimia in women. But among men, they often go unrecognised. It's estimated that 1 in 10 of the 90,000 people who suffer from eating disorders in Britain are men, and experts say the numbers are rising. One man told More 4 News they had seen a 50% increase in men suffering from bulimia in the last 2 years. Well, we spent a couple of days with Paul Radcliffe, a 22-year-old who's suffered from an eating disorder for over 6 years.
I've had an eating disorder since I was about 16, roughly. It started off as obsessive exercise, went on to making myself sick after every meal, and intermittent kind of starvation period. Because I became like obsessed with mirrors, and, like shop windows, car windows, house windows, mirrors, anything I could look in and kind of look at myself. I would, just to make sure I didn't stick out anywhere. I look in the mirror on a bad day and see someone, I don't know, big chest, fat stomach, like beer belly kind of thing. Even though I know it's not there, it's just what you see. Just too big.
Want a drink?
No, I think so.
Right.
It affects my family because I obviously have to put up with my moods and with how I am and the worry of, is he going to eat anything, is he going to be sick, is he going to do this or that. So it probably with my family more than anything, yeah.
He keeps it to himself because he thinks it's up to him to get over it. But we do like to help, but we've got to now.
But there's no way you can help.
No.
We can't
We
help
can just give you support and encourage
Yeah, but
them.
you can. Yeah.
I'll do anything I can
Thank you.
to help you.
Can you tell your parents now how you feel right now talking to them about it, and be honest?
I don't know, just horrible. It's horrible. I do. I'm tense and hate it. I wish I was anywhere else but here. It's awful to talk to you about it. Not because you're horrible or anything, just because it's really difficult. Because it's easier to just keep it to myself and... I don't know what you could say triggered it. My grandma died when I was 16, I think I was, and that was upsetting. A couple of occasions, kind of, I was primary school and secondary school, I was called fat. It became more of an issue when I got older, that in the back of my mind saying, well, you've been called it before, so you must be. And kind of gave weight to my own argument that I was fat and needed not to be. It was more difficult to come out and say and admit to the problem, being a male, because there's always that worry that no one will believe you, or because it just simply doesn't happen to men. Obviously the stigma of being a male is that you can't show that side of it because it's not macho and it's not big, but that's the problem, because you need to be able to talk about it to get into therapy to get over it. So it's a bit of a catch-22 situation. Last year I started seeing a psychiatric nurse.
And how's your eating been over the last couple of weeks?
Getting there slowly. As we say, each time it's a little bit more, another kind of notch. And then it's got better, and every other week. I've been with my girlfriend for a year, and she knew right from the offset that there was this problem. There was never any covering up or anything. I told her right from the beginning, and she's been brilliant. She's been very supportive and very good. It affects my sex life, I suppose. I don't like people being able to see my body, so it's affected it a little bit, but not too much. It is completely debilitating. It is tiring because, obviously, aside from the physical aspect of being constantly sick, which is absolutely shattering, it's also you're concentrating the whole time and worrying the whole time. I've been trying to get over it, and I'm finally nearly there, but it's just kind of got a hold on it. It's one of those things that's so difficult, and I don't want it there, but it's so hard to get rid of. It's like an addiction or a habit, like a drug habit or something. You're so dependent on it, even though it's a bad thing. You can't help the dependency issue.
That was Paul Radcliffe talking about his eating disorder. Well, with me in the studio now is Dr. Ian Banks, who is president of the Men's Health Forum. So why does this go unrecognised in men so much? Presumably the symptoms are similar to those of women, it's just not diagnosed when it's a male patient.
That's right. The Men's Health Forum has looked at this in terms of the perception of illnesses. So things like osteoporosis as well, for instance, which is perceived as a woman's condition, tends to get under-recognised. But certainly anorexia, we now know it's between 10 and 20%. That's a big difference. And we don't know the actual figure because we don't know how many men are suffering and not going to see their doctor.
But why is it that do people just not think of it as a men's illness and so they look at the symptoms and assume it's something different?
Well, that's certainly one aspect of it, and I'm afraid I'm as guilty as many other doctors because I actually had a patient who was anorexic as a young man. And it was only when his girlfriend actually said to me, you know, could you possibly suspect it's anorexia, that the light bulb went off above my head and realised that I was actually dealing with a man with anorexia. Now, that actually is a good indication of just how poorly the medical profession can sometimes look at an illness which they perceive should really be in another person. And that's a classic for anorexia.
And how do you treat it? The same way as you do in women, or does it have to be something different done for men?
Well, this is one of the things we're interested in for the Men's Health Forum, because what we have found is that very often men and women respond differently, not only to health messages, but the way they respond to health treatments and medication and so on. So I don't think there's been sufficient research really gone into how do you look after a young man, for instance, who has anorexia, because simply saying that it's exactly the same as in women is not good enough. What we know is that men do respond differently and actually act differently upon health messages, not least in the way they go and see the doctor in the first place.
Dr. Ian Banks from the Men's Health Forum, thank you very much for coming in to talk to us about that. Our main